Hospitals by Professor Tammy.
Hospitals Part 2. There are different types of hospitals. Let's look at Figure 8.3, the types of hospitals in 2016. So these number of hospitals are about 5,686, and note, due to rounding, the data does not add up to 100%. So about 51% of the hospitals are private nonprofit, 19% are private for-profit, 18% are state and local government, 4% are federal, and 9% are other non-federal. And we want to look at the different specialty of hospitals. 1. Community hospitals, public hospitals, private nonprofit hospitals, private for-profit hospitals, general hospitals, specialty hospitals, psychiatric hospitals, rehabilitation hospitals, children's hospital, rural hospital, teaching hospitals, osteopathic hospitals, military hospitals, emergency field hospitals like the Javits Center Hospital, or known as the coronavirus hospital, the COVID hospital, the makeshift emergency hospital, the hospital tent, and not to be mistaken with the floating hospital. Types of hospitals. Community hospitals, a non-federal short-stay hospital whose services are available to the general public. More than 87% of hospitals are community hospitals. So the characteristic is based on Exhibit 8.4, characteristic of a community hospital, page 192. Non-federal hospitals operated by local and state governments can be community hospitals. They have short stays. The average length of stay may be 25 days or less. It's open to the general public and is private, for-profit, or non-profit, general or a specialty hospital. Types of hospitals. There are public hospitals. They're government-owned, so it's government ownership. They can be federal, state, or local. And New York City have government hospitals owned by the city, and it's called Health and Hospitals Corporation, HHC, if you've ever seen it. Public hospitals are about 1/4 of U.S. hospitals. Only state and local hospitals are open to the general public. Often, they're located in large urban areas. They serve mainly inner-city, indigent, and disadvantaged populations. They have higher utilization. They offer a substantial amount of charitable or charity care. Number of hospitals owned by state and local governments have declined, so there's less of them. Private nonprofit hospitals are also called voluntary hospitals, non-government and privately owned. They make a profit but do not pay taxes. They're operated by community association, churches, other non-government organizations. More than 50% of all U.S. hospitals are private nonprofit. IRS requirements must provide some defined public good like services, education, and community welfare. It cannot distribute profits to any individual. Research shows that both non-profit and for-profit hospitals provide charity care. Non-profits spend a little more on charity care, but the difference is small. The types of hospitals. Private for-profit hospitals. Proprietary hospitals, also referred to as investor-owned hospitals, are owned by individuals, partnerships, or corporations for profit. They're operated for financial benefit of stockholders. General hospitals. Most hospitals in the United States are general. Maybe that's why there's a soap opera called General Hospital. Haha, bad joke. Provide a broad set of services for various conditions, general and specialized medical care, obstetric, diagnostics, treatment, and surgery. General hospitals are not less specialized or inferior to specialty hospitals. The difference is the nature of services, not the quality. Specialty hospitals focus on a narrow range of services for specific conditions or patients. Specialty hospitals include psychiatric, rehabilitation, tuberculosis, children's hospitals, etc. Others specialize in orthopedic surgery, cardiology, or cancer. They have a distinct service niche. So they have like a specialty that sometimes they focus on. Psychiatric hospitals provide diagnostic and treatment services for patients who have mental illnesses. Most have facilities to provide psychiatric, psychological, and social work services. Must have a written agreement with the general hospital for the transfer of patients. Most mental health services are delivered in private psychiatric facilities and outpatient treatment centers. And remember, outpatient treatment center, do they stay there overnight? No, they don't. Only inpatient is when you stay overnight. I just want to make sure and review. Rehabilitation hospitals provide intensive therapeutic services to restore maximum function. Types of patients include amputees and those with spinal cord or head injuries, like from accidents or sport injuries, or even stroke victims. The treatment usually after an orthopedic surgery. They provide physical therapy, occupational therapy, speech and language pathology. So physical therapy is like someone works with you to make sure, like when you walk again. Occupational therapy, helps you with your movement still, like I believe it's with like writing skills, picking up skills. Speech, it helps you with your swallowing and speaking. And language pathology, I guess language. Children's hospitals are like community hospitals. They treat chronic, congenital, cardiac, and orthopedic pediatric problems. They have intensive care for a variety of conditions such as cancer, cystic fibrosis, tissue transplants. And they have a higher staff ratio than a general hospital because children need more attention. And also the beds are smaller, and the chairs are smaller. Things are made differently for children. It's until children are 18 years old because children's development are very different. So just think about a hospital full of pediatrics with different specialities. Some of them have different specialities. Rural hospitals. They're located in a county that is not part of a metropolitan statistical area, MSA, generally treat a larger percentage of poor and elderly patients. Often find themselves in financial trouble and face closure. Critical Access Hospital, CAH, Medicare designated for a rural hospital that has 25 or fewer beds, provide 24-hour emergency care. Critical Access Hospital, CAH, are reimbursed according to the retrospective cost plus method, not the PPS prospective payment system. The reason is if they did it through the PPS, they'll be totally broke. So rural hospitals are financed a different way than other hospitals are. Teaching hospitals offer one or more graduate residency programs approved by the American Medical Association. Primary role is to train physicians. Major teaching hospitals are affiliated with universities. They have substantial teaching and research mission. They deliver specialized care for most complex conditions. Academic medical centers have active collaboration among a university, medical school, hospital, health system, and healthcare professional. Osteopathic hospitals are community general hospitals. They have a holistic approach to treatment. In addition to traditional allopathic approach, since the 1970s, allopaths and osteopaths have been practicing side by side. Many of these hospitals have closed because separate hospitals have become unnecessary. So you'll see like some hospitals, they're starting to have what we know as complementary medicine or alternative care like acupuncture um, in their hospitals.
See you soon. And remember to read the book.